Hi, I'm Lauren Masi, Doctor of Physical Therapy and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how physical therapists find the cause of numbness and pain. Let's take a step back. One thing when you come into my office is I can't feel what you're feeling. I can't jump into your body and know. So I'm going to ask you to describe your pain to me. What does it feel like? And as soon as I start to hear words like numbness, tingling, or sometimes even burning, or even in certain cases, a deep ache, those can be descriptive words that patients are going to tell me when they're talking about pain that's coming from a nerve. Now, most obvious, numbness and tingling. If you have compression of a nerve, you might end up having numbness and tingling. It's not a guarantee, but it usually does indicate that a nerve is involved. Also, if a nerve is involved, sometimes you might even notice weakness of the muscles which that nerve innervates. So as a physical therapist, my job is to figure out where's it coming from, get to the root cause so that we can make sure that we can treat that area as effectively and efficiently as possible. Now, when it comes to nerves, sometimes symptoms can travel. They might not be exactly where the compressed area is. It can even be patchy or very localized to a different area. And sometimes you might be able to draw a line where it connects from its origin to the distal part that's affected, or the end part of that nerve. But it doesn't have to follow a specific trend. So by that I mean, I've had a patient who came in complaining of pain only in her big toe. And she was trying to rack her brain on what it could have been caused by. And she's like, well, maybe I bumped my toe into the bottom of a clothing rack when I was shopping one day. But really, she couldn't figure it out. And again, after I look at her toe, nothing really seemed to match. So I had to follow the chain back up, look at the whole rest of her body. We have talked in the past in prior vlogs about how the whole body is interconnected. So one thing that we want to make sure is that, as a physical therapist, I do know where certain nerve roots from your spine innervate, and typical distributions down, say, your arm or your leg, where those can trace back to. There's also something called peripheral nerves, where nerves that branch off out in the arms and legs might be entrapped local to that area. So it's my job to figure out where that is. Now, some people will use the word sciatica when they're talking about pain down the back of their leg, and that is a catch-all term. Sciatica can be caused by multiple different origins of pain. It might be something compressed up in the spine at one of the nerve root levels that eventually become the sciatic nerve. It could be compressed a little bit under your piriformis muscle in your buttock, and we have to figure out exactly where that is causing the compression so we can take the pain away from the rest of your leg. When it comes to the hand numbness and tingling can be caused by carpal tunnel, a very local issue from the wrist down, but it can also be caused from your neck. Different nerve levels in your neck can cause pain there, and as I mentioned a moment ago, it might not be pain going all the way down your arm. You might not even have pain in your neck. You're just feeling it in certain distributions within your hand. And again, it's our job to, based on what you describe to us and what fingers you tell us it's in and what surfaces of your hand, that we can trace it back. So we want to make sure, again, that we look above and below the area, that we look at the whole body, and we do the tests and measures that we have learned in school and through our experiences to help figure that out. If we are unsure or we want to get a more clean-cut diagnosis and where it's coming from, we also have nerve conduction studies and electromyography, or EMG, which can help us to get to that root cause and pinpoint the area of your nerve trouble. So again, if you have not seen our prior vlogs on diagnostics or carpal tunnel, please take a peek so you can see how we can help get to the root cause of your numbness and tingling and then be able to provide treatment. Thank you so much. If you need anything, please reach out to Bay Area Physical Therapy today for a complimentary consultation.